which encompasses all the elements required for healthy living. Our national health policy seeks to move away from the sick care to the wellness with thrust on prevention and health promotion. Homeopathy, a science of gentle healing, has been in a practice for prevention of epidemic diseases since its inception. To understand the role and challenges of homeopathy in public health, today we have this session. We are privileged to have with us Dr. Samir Kumar Bhattacharya, former director and professor of National Institute of Homeopathy. He is author of many books. We are privileged to have with us Dr. Bhattacharya as a chairperson. I invite sir on the dais. Thank you, sir. I would like to invite Dr. Nandini Sharma as a chairperson. She is presently working as a homeopathic physician at Rashtrapati Bhavan and has a multiple professional recognitions. Also received an appreciation award from Central Council of Homeopathy, Government of India. She is a member of Standing Finance Committee CCRH and also WG Epidemic Wing LMHI. She is also a part of Project Screening Committee, Ministry of Ayush under the Government of India. We are pleased to have you with us, ma'am. Thank you. Now, today's speakers for this session are Dr. Isaac Golden. We invite you, sir, on dais. He is the world authority on homeoprophylaxis and was the first person to awarded a PhD from mainstream Australian University for research on homeopathic topic. He was honorary research fellow, Faculty of Science, Federation of University Australia from 2013 to 2016. We welcome you, sir. Our another speaker is Dr. Swasti Charan. We welcome you, sir. He is currently serving as a Chief Medical Officer in Director General of Health Services, Ministry of Health and Family Welfare. He is looking after NPCDCS Ayush Integration Project, National Tobacco Program and Natural Oral Health Program. He has completed his education from the Regional Institute of Medical Sciences, Imphal, further MD from National Institute of Health and Family Welfare, followed by Masters in Public Health from Massey University, New Zealand. His main interest and thrust is on integration approach for implementation of National Health Program. We welcome you, sir. Our next speaker is Dr. K.M. Dhawle. I request sir to be on the dais. Dr. K.M. Dhawle is a leading academician and a well-known physician practicing at Mumbai since 1983. He is the trustee of Dr. M.L. Dhawle Memorial Trust and principal of Dr. M.L. Dhawle Memorial Institute. Our another speaker is Dr. Reggie Kumar, Medical Officer, Department of Homeopathy, Government of Kerala. I welcome you, sir, on the dais. He is also engaged as a technical committee member, principal assessor and faculty member of NABH, that is National Accreditation Board for Hospital and Healthcare and Quality Control of India. He worked as a state program manager and state program manager for Ayush and Homeopathy in National Ayush Mission, National Rural Health Mission. We welcome you, sir. Another speaker is Dr. Devdutt Nair. He is scientist to research officer at CCRH. He is the recipient of Young Scientist Award of CCRH in 2017. He has co-authored a book, An Update on Bowel Nosode. Has 20 papers published on his name and in 20 peer-reviewed journals and 20 in national journals. We welcome you, sir. I invite Dr. Golden Isaac to start with his presentation.
distinguished panellists, ladies and gentlemen. It's a great pleasure to be with you. Because we are running late, I'll try and keep this as relatively brief as possible. When I received this topic from Dr. Manchandra, well, actually, it wasn't the full topic, there was more. It was my perception of India and then my perception of Indian homeopathy and what's needed to strengthen it. I felt very apprehensive. And the reason I felt apprehensive is because I'm a guest in your country and I was asked to come here and tell you what's wrong with yourselves and how you should improve. And I thought, well, there's a lot of scope here of saying the wrong thing, and if I say the wrong thing, I may never be asked back again. So I had to think very, very carefully. And it's led to a talk which is somewhat political. And it's been so interesting the last day and a half to hear your level of awareness and concern about international activities. And I'm very heavily involved with that in Australia. You of course know about the NHNMRC report. Well, I've written a number of papers showing that the NHNMRC report, which has condemned homeopathy as lacking an evidence base, is in fact an example of scientific fraud. And at the moment, the NHNMRC are being taken before what we call the Commonwealth Ombudsman, which is a national body designed to adjudicate as to whether national bodies like the NHNMRC have committed offences. And this is enormously important because if the Ombudsman's attempt is successful, then that whole report will have to be retracted internationally. And the peak medical science body in Australia will have to admit that they, in fact, have committed scientific fraud. And so much of the pressure that's stemming from this report throughout the world will actually be withdrawn. Anyway, God willing, time will tell. We'll know this year, hopefully. But getting on with my talk, I'm going to start with a little bit of a background from Cuba, because something happened in Cuba which is very instructive and I think will also be instructive for India. This one? Yep. Okay, so unfortunately you can't see the quality very well, but this is a photo taken from the Finlay Institute, which is the institute in Cuba, which is a vaccine manufacturer for the country, and they export vaccines to other countries in the world. And the lovely lady in the middle, is it possible to, like you did with those? Yeah, is Dr. Concepcion Campo Huguero, who was president of the Finlay Institute for many years up until 2015. And next to her is Dr. Gustavo Bracho, who was the person who's vice president of Finlay, who actually led the homeopathic immunisation programs there. And this is an example of genuine science, because neither of those two are homeopaths. They're orthodox medical scientists who are experts in vaccine manufacture. And yet they led the homeopathic interventions in Cuba. In other words, as true scientists, they took the view, if it's best for the people, then we'll do it. They saw the results. And from 2007, actually the first intervention they tried was in 2004, a very small one, but really from 2007 to 2014, there was a range of interventions in Cuba which were really impressive. They started with leptospirosis in 2007 and 2008 in the 3 eastern provinces of Cuba and had wonderful results. In 2010, for example, when the swine flu scare hit the world, the government of Cuba instructed these two to immunise the whole country over 12 months of age homeopathically against swine flu. Well, there were so few cases that we couldn't really judge how effective the medicine is because we didn't know how many people brought the disease in. But being Cubans, they love mixing things up. So at the same time, they also immunised against pneumococcal disease. And we did have long-term data for pneumococcal disease. And when you look at it, the 2010, there was a huge dip in the incidence of pneumococcal disease, and then up again the next year. And they covered a range of diseases from 2007 to 2014, dengue, and a range of other diseases. But what happened in 2015 which changed this? Dr. Camper was a very close friend of Fidel Castro. In fact, they used to call each other each day. And as he weakened and as his influence in Cuba lessened, her patronage, for want of a better word, changed. Now, there were a number of people in the scientific institutes in Cuba who were very opposed to what she was doing. They were opposed to the use of homeopathy. They said it wasn't scientific, even though it was working brilliantly, even though the results were there for the whole country to see, to the extent that the government had actually instructed them to immunise the whole country. There were still people in orthodox medicine there that wanted to get rid of her, and in 2015 they did, because Fidel's brother Raul did not have the same connection and passion. And the reason why I'm giving this as a little introduction is because the same thing can happen anywhere in the world. And you're in a unique situation here in India where you have political patronage, effectively. Your Vice President opened the function yesterday. Your Minister of Ayush was here. You have a Department of Ayush, which puts you ahead of most Western countries, certainly mine. And what this shows is how fragile sometimes this patronage can be, and how one person moving a position, leaving a position, can make a huge difference. I mean, at the moment, your Prime Minister, he meditates and does yoga. Well, our Prime Minister has shares in pharmaceutical companies, and his wife sat on the board of a number of pharmaceutical companies. It's a bit different. And the point I'm going to make is that what you have is very precious. What you need to do while things are in your favour politically is to strengthen homeopathy in India to the point that even if and when your Prime Minister changes, your ministers change, the position you're in homeopathy in India now will not change with that. You have to insulate yourselves from that, because it's so important for the whole world that you do. Okay, so I'll just read through these very, very quickly because they're in the proceedings booklet. If you haven't got it, they've got them at the tents outside. So my perceptions of India and homeopathy in India. You understand and respect the true heart of homeopathy. And this is probably because of your spiritual background as a nation. Because Hanuman himself was a deeply spiritual person. He knew that we were more than our physical self. He, as you know, talked about the emotional self, the intellectual self, and how we had to look at a holistic approach to health. You know, in terms of numbers and usage, you're the powerhouse of homeopathy around the world. And under the auspices of the Ministry of Ayush, you lead the world in providing a political setting which supports homeopathy and other forms of natural medicine. Obviously, you're a massive country, and one only needs to drive in the traffic to see that, how many people there are. And it's a change for me coming from a place like Australia that it takes hours sometimes to go a few kilometres because of the traffic. But what it also means, one size doesn't fit all in terms of solutions, because, you know, there are areas of affluence and there are areas where that isn't the case. And I would see, as an outsider, to the extent that I can, that homeopathy in India is currently mainly a practical response to a massive need. And the massive need, of course, is treating and caring for health of so many people. Now, the CCRH is certainly bringing a degree of academic rigour and increasing that all the time. But there's a way to go. But you do have resources here which most other countries do not have. in terms of populations in which, for example, simple example, to do provings. In many other countries, it's a struggle to get enough people to do a proving. Here you have, well, almost unlimited numbers that, whether they be students or graduates or members of the public, to be involved in research projects. And internationally, homeopaths around the world look to you to keep Hahnemann's dream alive and to provide leadership into the future. And that's a simple statement of fact. And I know when I travel the world, I'm not widely travelled, but I've spoken in 10 different countries. India has always looked at and looked to provide leadership in the area of homeopathy. In terms of what needs to be done to strengthen homeopathy in India, as I started by saying, to me, maintaining the political support for Ayush modalities, including homeopathy, is central. And you need to ensure that it remains strong as political leaders change. To me, that's such an important thing, because we see so often when individuals change in roles of responsibility, it can have a massive impact on homeopathy and other forms of medicine. Answer criticism with evidence and make the evidence publicly available. This is one thing which is very hard in a lot of Western countries, because the media in Western countries is so controlled by pharmaceutical forces. We rarely get to see, this little thing again, we rarely get to see, it's that, okay, the truth coming out in mainstream media. But when there is positive evidence for homeopathy, it needs to be put out to the whole country so people know, and more importantly, so your politicians know. So it's constantly on their mind. Homeopathy has achieved this. Homeopathy has provided wonderful support for this disease in certain states, or prevention of certain diseases in certain states. It's so important to maintain that coverage and awareness. Homeopathic education. It's interesting, I've talked to various people since I've been in India, and there's a variety of opinions about how uniform the standard of education is, but a consensus seems to be that it isn't totally uniform across all of the different colleges. And that is also really, really important. And I see that CCRH are actually bringing in initiatives to try and improve the quality of education and the consistency of graduates, because this is enormously important to maintain respect internationally. Keep improving the quality of research, but, and this is my opinion only, don't become overly allopathic. In other words, when you look at the allopathic side of things, it's all randomised controlled trials and systematic reviews of randomised controlled trials. Now, one area of my interest, which I don't have time to go into today, is the weakness of that evidence base. Because we know, originally, randomised controlled trials were designed to check the toxicity of drugs. And originally, the pharmaceutical manufacturers didn't like them, but that changed. And now the pharmaceutical companies love randomised controlled trials. Why? Because they know they can construct them in a way to get the results they want. So an RCT is not the gold standard. In fact, some people think it's the fool's gold standard, because it gives an aura of authenticity and legitimacy to the work, but that work can be intentionally and significantly compromised. And for those of you who are interested in following the criticisms of the orthodox evidence base, I highly recommend the work of Professor John Ioannidis, Ioannidis, for those of you who are interested. Professor John Ioannidis. He is a statistician, he's a professor of statistics, he's also a professor of medicine, he's an orthodox doctor. But he came to fame in 2005, writing an article, Why Most Research Findings Are False. And that, of course, attracted a great deal of attention in the orthodox community. But yet, he's one of the most sought-after speakers on the international medical circuit. But anything that he's got his name to is worth looking at, because he really has exposed the weakness in the orthodox system of randomised controlled trials and systematic reviews. We need to look at all evidence. There's a Professor Harold Wallach who has talked about a circular model of evidence. In other words, randomised controlled trials are part of it. But so is every other type of evidence, and we bring it all together. And that gives us, if you like, a really holistic view of what's being studied. Keep pressing for the option of homeopathy to be considered as a genuine choice across all aspects of health, including both the treatment and prevention of both acute and chronic diseases. You know, we as homeopaths in every country, not just yours, can offer to governments in our countries the opportunity to save hundreds of millions and billions of dollars from the health budget. And every health budget in every country, developed or otherwise, is struggling because of the increasing burden of chronic disease. You know, the pharmaceutical companies have a wonderful business model. You reduce infant mortality, you increase longevity, and you increase the incidence of chronic disease. That's the perfect business model to sell more drugs. And that's exactly what we see in most countries in the world. So it's really important that we try and show politicians that homeopathy, being safe and gentle, it's not appropriate for everything. We can't do everything, but we can do an awful lot, particularly in the area of chronic disease and reducing the burden of chronic disease. And we can show our governments that we can save them huge amounts by doing that. If they won't listen to the medicine, then listen to the economics. And I've just talked about that point there. So given so many potential benefits that can come from a wider use of homeopathy, why is it not more accepted internationally? And I don't think I've got time to go through this in detail, but basically I've written a number of articles about how, beginning with the Shang article in 2005, followed on by the UK Parliamentary Review in 2010, in Australia, the establishment in 2011 of a group of anti-natural therapy doctors and professors of medicine and scientists called the Friends of Science in Medicine, a most inappropriate name, through to the 2015 NHMRC conclusion based on Shang that homeopathy wasn't effective, through to the NHMRC reports, which said that 17 different modalities, not just homeopathy, lacked evidence of effectiveness. In fact, that was their big mistake. If they'd just focused on homeopathy on its own, most people probably wouldn't have cared. But they have said things like yoga, which I assume is dear to many of your hearts, lacks evidence of effectiveness. I mean, it's ridiculous. Massage, herbal medicine, naturopathy. You can see the list of studies there. And some of them may be a little bit strange, but many of them are established, you know, with hundreds, if not thousands of years of evidence of practical use. And you can see within this little diagram here that I've shown the interlinking between these different events and how one feeds off the other. They're all feeding off the, you know, original Shang thing. The FSM is in the middle there. And it's affecting things like health insurance in Australia, health complaints commissions, a King report into pharmacies, and the Therapeutic Goods Administration report. All of these things are linked in intentionally together. And they're all based on fallacies. They're all based on non-science. So in a way, politicians hold the view, hold the key. And you can see I've got Professor John Ioannidis' name there, if some of you needed the spelling. But I'd also recommend, for those of you who are interested in understanding the true extent of interference in science around the world, in medical science, by the international pharmaceutical companies, Harvard University. Now, Harvard is regarded as one of the premier universities in the world. Their law school is up there with the best in the world. Now, they have in their law school and they spent 5 years studying the influence of Big Pharma on things like medical education, the influence on governments, the influence on advertising, the influence on doctors when they get out and practice, the influence on purchases of drugs in hospitals, etc., etc. The influence on organisations that are established as consumer groups, health consumer groups, which are fronts for this. So I'd highly recommend for anyone who's interested in this area to look at this. It's free on the internet. A few years ago they published 16 articles, each one by an expert looking at the different area of this whole topic, and they published it in a law journal. This is irrefutable evidence by people who are completely objective, with no skin in the game, as they say, about the malicious attempts and the effects of Big Pharma. Evidence must be relevant, as I mentioned before. Very interested, Retraction Watch talked, once again, Ioannidis was talking about the harm that can be caused by giving credibility to studies that appear to be gold standard studies, appear to be high quality. One cannot be careful enough in reading this work. The future. So I've rushed through some of these things, but basically the point I was mainly trying to make is that at the moment you are in a special position here in India because of your political patronage. But it's enormously important that you spread the message about homeopathy throughout your country, and always keep the positive things about homeopathy, the great results you've been having, in front of the public's mind, and even more importantly, in front of politicians' minds. Because we and the rest of the world look to you very much to keep homeopathy flourishing, to keep the flame that Hanuman lit so many years ago burning brightly. And as long as your politicians support Ayush, and as long as there are honourable scientists producing relevant and appropriate research into homeopathy, then your place and what you can contribute to the world is assured. God willing, you will do that, and people like myself will find the honour of coming to your country, observing what you do, learning from what you've done. This is my 4th visit to India. I originally came to learn about your massive homeoprophylaxis interventions, and I've been coming every year since. So thank you very much.
I request Dr. Swasti Charan for his presentation on homeopathy in National Program for Prevention, Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke.
Thank you. Distinguished delegates and speakers on the dais and my colleagues in the audience. At the first outset, I would like to start with a disclaimer saying that I'm going to present a work which is wonderfully done by the Ministry of Ayush, particularly the Central Council for Research in Homeopathy. Dr. Oberoi is here, Dr. Rosa here, and Dr. Mansanda should be around in this hall, in this campus. It is their good work which we happen to collaborate with from Ministry of Health, and I have been lucky enough to be presenting this as on behalf of the whole team. So it is not a presentation from Ministry of Health alone. We have a program what is known as NPCDCS. No, it's a tongue twister. And when we joined the NCD team early, we took at least 1 month to remember the full form of NPCDCS. So the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. And when we speak about the NPCDCS, then the people who are looking after kidneys, they start saying that, oh, kidneys is also another non-communicable disease, and you should put K there, you know. So we are also struggling to put NPCDCS and K there. And then when we start looking into the documents of NCDs, then we also know that COPD is another non-communicable disease, and the COPD component should be there. So, but even though the name is the diseases are not there in the acronym of NPCDCS, it is already well taken care of in the Health Ministry's national program. We do have a dialysis control program to take care of some part of the CKDs, and we also have a component of COPD in the National Health Mission by means of saying that, you know, every district who wants to do some setup for the COPD is also given a grant about 25 lakhs for doing a setup for the the COPD component. And this is the flagship program for prevention and control of the NCDs, what is known as the lifestyle diseases. And Ministry of Health launched this in July 2010. It is a very relatively new program compared to other programs like NBVDCP and revised National Tuberculosis Control Program. This is a relatively new program, but in the sense that when it is new, you do not know how much it will be successful. So you start with a project, with a pilot in the mind, you know, and then we have gathered the steam, but we should be aware that it is not in the best step that we would like to. It is best in the papers, but we are still facing with lots of challenges. The challenges being not due to the component of the program, but due to the fact that, you know, the NCDs, the NCD patient, the potential patients, you know, I'm sure at least even in this hall also, many people would not have done blood sugar estimation of their own blood sugar in the last 3 months. I'm sure many of us should be doing it, you know, after you cross 30 or even say 40 on a safer side, you should be doing blood sugar estimation, but I'm sure many of us must not have done it routinely, because if I do it, I might get, you know, diabetes, as if, you know, we think that we will escape the diabetes by not doing the result. So that is the mentality even for us doctors. You can imagine what would be that in the community. So because people are roaming around healthy without any symptoms, they are not into the net of the NPCDCS program. So the NPCDCS program remains very good, unutilized. So that's what I wanted to say. And now, when we envisage a very ambitious program, you know, at the primary health center, then the community health center, and even at the district health center, we should still know that India has got a huge disease burden of other health conditions, particularly the communicable diseases, and also we have the mother and child, which is still the primary concern of the ministry, because we want all mother to be safe and all newborn child to be born safe and grow well. But the thought for the NCDs is well there, but it is not yet taken care of. So when you go to visit a community health center or a district hospital, you tell them that you are a team from the NPCDCS, the NCD team. So one room will be designated as the NCD clinic. Okay, so you are here. No? Tomorrow that room might be the RNTCP unit there. It can be a tobacco cessation center there the next day, because they have to play different roles in that particular health facility. So these are the challenges that we face while we are implementing this project. So now our project started very humbly about 2 years ago, when we had a meeting with the then DGHS, Dr. Jagdish Prasad, who himself happens to be a cardiothoracic surgeon and the secretary of Ayush, in one afternoon. And we happened to be there, and that afternoon we decided that we will roll out the NPCDCS Ayush integration for prevention and control of NCDs. So that's how we started. As I said, these are the main diseases which we are doing, and we all know what are the risk factors of NCDs. So tobacco use is one of them, then harmful use of alcohol. I do not still understand what's the harmless use of alcohol. So for me, alcohol to any extent should be harmful, because it can be a gateway for harmful use. And then the unhealthy eating, not just the French fries, but a myriad of other diseases as well, and the physical inactivity. And now we all know what's the burden of NCDs in India. They cause to about 70% of the deaths worldwide. And as I said, people die of different diseases. When there is clustering of the cases in time, person, and place, like we have an accident in front of this Bigyan Bhavan, when 5 people die, then we say that 5 people, all of them died in front of me, like that. No? But in NCDs, what happens is some people die of throat cancer, some people die of a hemorrhagic shock, and they die from different diseases in different parts of the country. So we think that It is not as big a burden as it is. The Indian picture shows that 61% of the deaths are from NCDs, then the 23% are at risk of premature death from NCDs. Now we could premature in the sense that you are not dying when you should be dying, you are dying quite early beyond the prediction. So out of every 10 individuals in India, we estimate that one has a raised BP. So if 10 people are sitting in the front row, then some of us should be having a high risk BP, and 2 should be having blood glucose, and 2 should be having blood pressure, and 2 of us would be overweight by the calculation, and 3 people. Now it is little reduced, so we have achieved some reduction in the tobacco use, but we still say around 3 in 10 persons should be using some form of tobacco or the other. So we can see the risk factors then. So this is how the mortality of NCDs in terms of the different diseases that we have listed out. And India has started well, that we have the national monitoring framework on the NCDs, and we have set ourselves in 10 targets. Oh, 10 targets, there's some loose, 10 targets, 10 targets to be attained by 2025. And during this, we look into the different risk factors, like around 2025, we should be able to reduce relatively in all the components of the risk factors and the NCDs. So we have a dedicated National Tobacco Control Program, National Oral Health Program, and then we have the NPCDCS. So we are aiming very ambitiously in the country. India is one of those few countries which has this NAC here, the National Action Plan. Now, as I stated in the beginning, we wanted to do this integration, and we started with a dream of doing it in about 100 districts, and then we started on looking at the possibilities of doing it in a bigger way. But during that time, we also should know that Ayush Ministry was just born, and being a newborn, Ayush Ministry has a ministry, but the technical component of like the Directorate of Ayush, in one sense, the technical wing wasn't still there, and we were still working with the central councils of Ayurvedic sciences, then CCRH and the CCRUM and the naturopathy, the councils. That the council has a mandate, you all know much better than me, that of research, but they are not a directorate, the technical wing, which should be, running the program, putting inputs to the national programs like this. But then we wanted to start somewhere, so the Ayush Ministry instructed the 3 councils. One is the CCRH, CCRAS, and the CCRUM, and then the yoga, of course, should be a component of all the 3 projects. So we started that way. So if you go from east to west, in Gaya in Bihar was with CCRAS, and then we have got Surendranagar in Gujarat, and Rajasthan in Bhilwara in Rajasthan with the Ayurveda Council. So we have 3 of them. In homeopathy, we started with Krishna district in Andhra Pradesh, and then we have the Darjeeling in West Bengal. So we have 2 initially. And then with Unani medicine, we had Lakhimpur Kheri in Uttar Pradesh. And all of this component, they have got the yoga component. So we started with a model. Then I would like to inform this house that, the CCRHs were the first to come up with the first model, which was to be launched in the 2 districts, and we wanted to choose one of the best districts in the country in terms of NPCDCS implementation, as well as the strength of homeopathy. By strength, we mean to say the state should be acceptable, and then there should be acceptability of homeopathy in that particular district where we want to launch it. We should not be doing in some places where the acceptability of Ayurveda or Unani is higher than homeopathy. So that was the practical decisions we took, and the district which we chose to start was Krishna in Andhra Pradesh. And we had the RRI, the Research Institute in Guriwada. So that was one of the criteria, that we should have a hand-holding institute which should be, doing all the facilities, facilitating the facility survey, and then the coordination with the state government, etc. So now, what are the objectives of this integration? It is primarily for prevention of the common NCDs, which we have listed out. And then, as I say, what is plaguing the system of NPCDCS is, like, we are not able to catch those potential patients who are still roaming around thinking they are not having any risk factor or even the disease, the NCD. So we need to do the screening. The screening component is already there in NPCDCS, but because of many factors, it doesn't happen as it should be happening. So we needed to augment the screening component of the population for detection and diagnosis of NCDs, and then early intervention. We prevent them from getting into disease and the complications. And to provide cost-effective treatment. Now, treatment here, we do not just mean the allopathy treatment. It is the treatment of the Ayush. So in this district, which we are collaborating with CCRH, we are going to have the homeopathic component of treatment along with the allopathy. So when you walk in to a health facility, say a community health center, a patient or a potential patient. Now we have started even looking at the patient party which brings a pregnant mother, the husband of a pregnant mother. Bringing a pregnant mother to the hospital is not a risk factor, but it doesn't save you from not suffering from any of the NCD. So if you are above 30 years, if you are bringing a patient to that health facility, you can still be and you should be screened for the NCD. So that's why when a person walks into it, we ensure in such a way that all the crowd goes through the NCD clinic, which is manned by both the allopathy as well as the homeopathy. Now, once they go through that, we screen them together. And then if the patient is a known case, for example, of diabetes and he is on allopathy, then we tell him, okay, you can continue to have your allopathy treatment if you are a patient of diabetes, and then please get yourself monitored by the lab investigations on a regular basis, and these are the counselings which we are giving you for the lifestyle diseases, and then you please learn and get yourself enrolled in the yoga classes which is available here. Okay, so that is one group. And then we see a pre-diabetic patient who is not on treatment, but he is on pre-diabetes, he is likely to become diabetic in a few months' time. Then we tell them, look, you are not diabetic now, but your condition is such that you may become diabetic in future. So you need to do all these lifestyle changes. And we have something from homeopathy, so we can give you that, and then continue with the monitoring, and please join yoga. Yoga is common for all. And now if somebody says he's diabetic for the first time, then we tell them, okay, we have got two options for you. You can either take homeopathy or allopathy, or you can even combine them. And then if someone says, I want to take homeopathy alone, then he continues homeopathy. And then we monitor them. The most important component of this is we enroll them in such a way that there is a line listing. We have the Japanese encephalitis presentation there, then we do a line listing. So when you have a polio case, we do a line listing. But on NCDs, it is never like that. If you visit one of the, not far from the capital city of a state, when we visited a health facility, number one, the first patient is Ramesh Chan, son of so-and-so, like that. Then the age, sex, and then the diagnosis. Then till 10, it is continued. The 11, 12, then if you continue, if you turn the pages around 200, you forget the diagnosis. The name itself is not a Ramesh, has become R and some SH. No? It's in somewhere, and you do not have the data beyond that. No? So now if I ask them how many diabetic patients are there, no? Then they will give me some data which may not be very scientific, that's why. But in this NCD clinic, we have a setup in such a way that we have the line listing of all the patients that has entered into the health facility, maybe for the first time for NCD patients in the country in this project. Okay, so that's how we are trying to integrate the treatment there. And then it is cost effective because we are not unnecessarily prescribing against the choice or against the system, and the patient has got a choice. Whether you like it or not, people are taking allopathy. Whether we like it or not, people are taking homeopathy, and people are also taking Ayurveda, people are also taking Unani. But the strength here is they are being monitored. So when a patient who is on allopathy treatment or an Ayush treatment goes haywire, we can catch them young there, and then we refer them to the higher centers where necessary interventions for the complications or the disease being uncontrolled can be possible. It is not to say that the treatment on homeopathy has failed. Allopathy also fails. No, the human body is such a way that you cannot treat all of them with one system. So, but what will fail us is fail the system, or what will fail us is we not being able to detect when the patient deteriorates. So that system we are going to, and we have created through this system that we screen them properly and then we monitor them on regular basis. This is the biggest strength of this integration project. And then to establish and develop capacity of the homeopathic doctors, not in the practice, but in the management of NCDs. If you remember, we are starting this facility in allopathy hospital. You know, when we started in the beginning for this project, you know, Dr. Praveen and both of us, we were very apprehensive. Then we were trying to design how do we project this, you know, how do we present this project to the state government. So we started with the state government. We went to the capital city, and then we made a small presentation asking, in a way indicating the blessings of the Honorable PM for integrating medicine in the country, integrating systems of medicine in the country, subtly telling them that we are here to implement the project. Now we are here to either not here yes or no. No, we are here to implement the project. So, and then we go to the district, the Krishna district. Then we do interactive sessions again to do away with the fear and apprehensions of both systems. Like, I'm going to go into somebody's house to establish a small room there. So I need to be cautious. So, but luckily in these few districts that we had done, we had an overwhelming response. We had some hiccups here and there in the beginning, but we succeeded to convince them. And then we have established that capacity of the Ayush system in this project. And then also to roll out some of the program in the homeopathic colleges and the attached hospitals. Now, we did not stop in the clinic, so we started building the same strength in the homeopathic college, which were hand-holding that institute. So now the screening happens there, homeopathic treatment, and advice on diet and lifestyle management and reduction of disease burden of the NCDs. This is how we are doing that. Now the structure we have is in the headquarter in ministry, just blocks away from here. In the ministry, we have what is known as NPCDCS cell there. We work very closely with them, and then you have the same structure in the CCRAs. And then we have what is known as the NPCDCS cell in the CHC, and then we have the PAC and the target population. And the units are being established now at the community health centers, what is known as the CHCs. These are the mid-level health facilities, which is just below the district level. And then we have a team, Dr. Manjula is here from the CCRS. She is our consultant in the monitoring unit, which we have in the DGHS. Now we know that data is the strength of any project, so we maintain very good data of this system. So at any point of time, our higher ups ask us the data. We tell them, sir, do you want a 1 pager, or do you want a 2 pager, you want a 3 pager, or you want 25 pager? We have them always ready with us. So to tell you the strength, India is now thinking in terms of Ayushman Bharat. We should be having the health and wellness centers in the sub-centers. When they look at any model of integration, I never expected that people would look at us like that. But when they look at any model of integration, allopathy and Ayush, they start looking at this model. So when they are having meetings at the PMO level, then they started texting us, do you have any model of integration? So we have model, but this is only for NCDs, but this we have done very well. So we send them the data that we have. Now, the program components is like, it is prevention through the health promotion, through the counseling session, and then screening them for the early diagnosis and the case management, as I've already explained to you, giving the patient a basket of choices, and then supervision, monitoring, and evaluation. Now, when the project is being launched, we will have many issues, Our boys who are working in the NCD clinic of the Ayush, we call it lifestyle disease clinic, just to differentiate a little bit from the NCD clinic of NPCDCS. And then they start thinking that, no, we are employees of the central government. And even though they are working in that unit, then we are only here for NCDs. We won't take care of any other thing. That attitude sometimes, it backfires on you. Like when we had a health facility in Bhilwara district, which was located next to the highway, and there was an accident of a bus accident happened, and the in charge of the community health center, who is also the boss of our NCD clinic, was complaining to us. All other people in the health facility in the CAC, including doctors, nurses, everyone is trying to help the crisis. But your people here, they say that we are here only for NCD. Then we told them, look, this is not acceptable. No, your boss is having a problem. Nobody is asking you to perform surgery. Nobody is asking you to prescribe medicine. But you can do the triaging. You can do the dressing. You can at least specify the patient party. You should be helping this. So these small things we had to solve many times. And every 4 months we go to any one of the on a very religious, regular manner, and we have just completed Darjeeling, and next week we will be going to Bhilwara district. And so every 4 months we go there, and then we integrate with the system. And now, in 1 year down the line, we know that all the units that we have established in the community health center, they have assimilated very well, and they are part of the whole team of the CHC. So that is the beauty of this integration model that we have done. As I said, Krishna and Darjeeling are the two districts. You can see that not because our photos are there, these photos are important because the Honorable Minister, Mr. Patnaik Saab, Minister of Ayush, is here in the photo in inaugurating the clinic in Krishna district. So when the minister agrees to travel for your program, please take it for granted that he takes your program as an important program. So this is a sign of the political will that you have for the program. So he did not just inaugurate it in only one. He did inaugurate in 4 of the 6 first districts that we launched. That means he took the program very seriously. So whatever happens to the program, we can always say that this program was initiated and inaugurated by the minister himself. So we should be having this program very successfully. These are the challenges that we have, and we are to look for the challenges, not to get defeated by the challenges. So that's how we started that, and then this is the monitoring visit that we do. And then we interacted, the whole team goes there, then we interact with the health facilities right from the state headquarter level to the district headquarter level, and then the community health centers. And then you can even see the yoga sessions there, a big hall. Yeah.
Sir, time is...
Yes, I will do that. We are done. The yoga sessions are there, and then we have got the awareness activities being done in many of the World Health Days. And then we are now expanding to Nasik in Maharashtra, Sambalpur in Orissa. Bhopal is also in pipeline, I think, and we have already done the facility survey. And then this is how the operationalization, which I have already explained to you, how we are doing it. And the implementation status, we won't go deep into the detail. This is how we are maintaining the number of patients being attended by the health facilities. And the achievement so far is the augmentation of the health facilities, and the screening level, which has increased like anything, and the prevention and promotive healthcare, then the cost-effective this thing. So we are also looking at this project with integrating with other related NCD projects as well. And the road ahead is, it is now an integrated part of the NPCDCS. It is part of the PIP now, the Program Implementation Plan. The first FMR code of the PIP in the ministry for the NPCDCS is this integration. So we have developed a unit model for all of them, and the many states this year is asking for the integration. And then National Health Policy 2017 also emphasizes on developing protocol for mainstreaming Ayush. This is one aspect that we are doing it. And then, as I said, the state PIPs should be taking us further in the next few years. So that is a very good prospect that we have for this integration. And I still say that integration is the biggest thing. Thank you very much.
Thank you, sir, for such a valuable information on NPCDCS Ayush Integration Program. Now I request Dr. K.M. Dhawle for his presentation on homeopathy for healthy child.
Respected chairpersons and friends, I am here to present a work that the CCRH has been done, and in the capacity as a chairman of the Clinical Research Subcommittee, I was privileged to be a part of this from several angles. And so therefore, this is a part of the work that has been. So when we speak about public health and when we speak about any intervention in public health, I think these are the 5 characteristics that we look at. We say that the intervention has to be straightforward and simple. It should be applicable on a mass scale. That is, it should use the existing health workforce. It should be acceptable to the consumers. The scientific studies should prove its efficacy, and it should be sustainable and replicable. Now, when we look at homeopathy as an aspect of the likelihood of introducing it in the public health, I think we see homeopathy as a highly individualized discipline. It needs a lot of training to implement. It is popular but not universally accepted, as we all now finding it, especially in the medical circles. As we have seen yesterday, it has less than adequate efficacy trials, especially the RCT. So we are facing certain challenges at the outset. So therefore, this project has to be looked at as a pilot project. As a pilot project which the CCRH devised in order to test the public health potential of the science. And as we know that a child is the easiest entry into the society, and a healthy child then becomes an objective which is valued by different stakeholders. So obviously, the broad objectives of the program will be to reduce morbidity and promote faster recovery, promote health through homeopathy, and to sensitize target audience, including health workers, patients, and caregivers about the benefits of homeopathy for common diseases. In other words, what we want to do is that we want to percolate the practice of homeopathy into the areas which are normally not available. So the project went through these different phases: identification of the areas, preparation and strategizing, training and sensitization, administration and monitoring. And as you see, we took up 8 states, 9 districts and 14 blocks. Now, the importance of the distribution of these states was that we were able to access communities in the rural areas, in the tribal areas, and in the urban areas, so that we get a fair amount of distribution of the level of socio-cultural development, education, and the way in which these societies will accept homeopathy. So this is the same thing in column form. And then we decided that instead of approaching a child as a whole, we decided that it would be a most appropriate thing to develop an intervention for teething. And the intervention for teething, though the pediatric textbooks do not mention that there is a problem of teething in children, but in society all of us know that teething becomes a problem which often harasses mothers and the families. And also incidentally, the Prime Minister has been mentioning about the use of homeopathy in teething. So that was a political advantage that we wanted to pursue. And that is how we had to first of all develop a training manual for the different categories of health workers which would be involved in this. So we had a preparation, we translated it into the different languages of the states. I'm just trying to show you that we had a Hindi translation. And in the Hindi translation, you are able to see the simple way in which we were trying to expound on what a teething problem is, what an irritability is, and what are the indications of chamomilla as a remedy, and also what aspects the health worker should take care in order to ensure that you do not persist with chamomilla and you take the right steps at the right time to refer the child. The second stage was the preparation of the drug kit, and it had to be a simple kit because we wanted the Anganwadi workers and the Ashas to be able to actually administer. So the kit was designed as a very simple, with comprising of only these 3 remedies which were commonly used for the conditions that we had already identified. And the strategy that we decided was that between 6 months to 1 year, all the children who are visiting Anganwadis or who are in contact with the Ashas will be receiving Calcarea Phos 6X. And if the children go through any of the clinical conditions, then we are able to prescribe for the dentition, for the irritability, and for the low-grade fever, the appropriate medicines for which the training was to be done. Now, I think that this is the first time that we have introduced homeopathy into the ground force. So we have involved the ASHA workers, the ANMs, and the Anganwadi workers. And obviously, we had to approach the district administration for allowing these workers to be used. And again, it was easy because we were very clear in our objectives. We were not tackling any life and death problems. We were only tackling issues which are a difficulty of society, but which are not very dangerous. So the permissions were given. We involved the homeopathic doctors who were working in the area. It is not necessary that they may be a part of the PHC system. And the type of training that we had to have a sensitization, a one-day meet, a mode of training, and we will just go through very briefly what type of trainings we gave and appropriate handouts which had to be given. This was important. The data had to be received and recorded. The data had to be very, very accurate. So we had to ensure that the communication patterns between the different health workers was good and accurate. And the only people whom we introduced anew was the multipurpose workers. And the multipurpose workers were directly answerable to the nodal officers of the CCRH. And they were the people who would be giving in the data and scrutinizing the data so that we are certain about the reliability of what we are receiving. There were monthly review meetings and the monitorings. We tried to put down what are the respective type of roles which the ASHAs, which the ANMs, they would perform in the project, as well as what the Anganwadi workers would. And the Anganwadi workers were the people who would be in touch with these aged children, because these children would be in the Anganwadis when the parents would be away. The role of multipurpose workers was to interact with the ASHA, get the data, compile the data, and report to the nodal officer. So these are the training programs that we did at subsequent for all the categories of health workers. This is the type of numbers that we have covered. 1,700 and so ASHAs and ANMs, 1,500 Anganwadi workers, and 44 doctors. These are the type of training programs that were done at different places. Practical training was also done, and then the distribution of the homeopathic kit to the ASHA workers was done. The sensitization of the homeopathic doctors so that they would know what the whole project is, and they would be able to receive the requests of the ASHA workers and the ANMs and respond to them. So the nodal officers were crucial in this entire process, and the nodal officers had to do something which they had not done so far. And that was something that required a lot of them to go out on the field and be able to interact at the level at which they were to do, and they had to also do a lot of administrative functions. The review meetings took place on a regular basis, on a monthly basis. Now, what are the preliminary results? So the number of children who have been enrolled in the project has gone up. So the last count in February 18, we had almost 68,000 children in the project. At least we have proved that dentition problems are not minuscule. I think the pediatricians should be able to note this, that almost 19%, 15%, 11% of our children do have these problems, and they are in need of some help, which we can give. These are the type of complaints that they have. Diarrheas are there in 37%, URTIs are in 54%, and the others are 9%. So this is a significant population which needs help. And this is an important slide. Whatever we taught the ASHAs and the ANMs, and whatever they administered, and we were able to get a phenomenal response in terms of the amount of children who were helped. And you're able to see the type of treatment and the type of help was almost 92%, 95%. And there were no side effects which were reported. Now, this is a thing that we don't know, we have to explore. Why have the incidence of these have gone down over the 2 years? Is it that the calcareous phos that we have administered has resulted in a reduction of the type of difficulties? This is a problem that we have to really explore in more great detail. The outcomes, as you see, so a large number of children in different parts of the country have been enrolled in the project. Out of them, the number of children who are suffering, a lot of them have been benefited with the use of the homeopathic medicines, and a lot of even the URTI and the fevers have responded. Now the problem that we faced was that this was a very preliminary study. So are we able to deepen it and are we able to scale it upwards? So we have an MOU with the CCRH and we have been working in the tribal areas. And we have initiated a training program which is at a much greater depth than what we have been able to do in the CCRH project. So in this we enroll these whom we call as Ayush Samajik Karyakarta, the ASK. We coined the term ASK because that involves a certain meaning. And we subject them to a certificate course with our state open university. It's a 6-month course. They are empowered in health, hygiene and homeopathy. And then they are people then who are collaborating with the CCRH project. These are some of the books that we have devised in Marathi, and we use these as training manuals for us, for our workers, and they receive this certificate from the Open University. So they have got something by which they are recognized in society. And the data that we have, now we empower them and we train them in a much deeper way to use more medicines and to cater to a larger group, a larger age group, as well as larger number of conditions. So this is what we have, the preliminary data that we are suggesting. We are having 433. You can see that right from baby to adolescence, we have taken these children up. We have seen the number of conditions that they have handled. It's not only diarrhea and URTI, you are having pain in the abdomen, conjunctivitis, diarrhea, rhinitis and all that. So we have got a number of conditions. We have tried to look at age-wise, which are the conditions which are common. So this becomes a very important epidemiological data, which our councils and our colleges can use in order to train both the homeopathic physicians as well as the health workers in this area. We see the number of remedies that we have been seeing and which the ASHA workers or our community health volunteers are able to use in a responsible way, and where they are able to get the results. So we are able to see that the basic intelligence in our health workers is very high. It is not that they are wanting to confine themselves to 5 remedies or 6 remedies. It is possible that if given the right of training and given the basic intelligence, they will be able to use a wider variety of homeopathic remedies and bring relief to a larger number of children. And you will see that the percentage of times that these remedies have been used by them. You see the range of illnesses and the remedies. You can see the correspondence between them.
तो प्रकार फारच आहे, त्याच्यासाठी आम्ही चॅमोमिला देतो.
बरं, तुम्ही जे रुग्णाला औषध देता ना, त्या औषधांचा गुण दिसून येतो?
हो, येतो.
कसं कळतं तुम्हाला?
औषध दिल्यानंतर 2 दिवसांनी लगेच पेशंट येऊन सांगतात की ताई तुम्ही औषध दिलेलं होतं त्याच्याने आम्हाला खूप फरक आलेला आहे.
बरं, रुग्णाला औषध दिल्यानंतर समजा बरं वाटलं नाही किंवा फरक नाही आला तर मग तुम्ही काय करता?
पुन्हा येऊन सांगतात आम्हाला. आम्ही आमच्या लगेच सेंटरला, भोपोली सेंटरला फोन करतो आणि विचारतो.
बरं, होमिओपॅथिक उपचार पद्धतीचा समाज कसा वापर करतो याच्या?
सुरुवातीला ज्या वेळेला मी काम करायची तेव्हा तर लोक अजिबातच घ्यायला पण बघत नव्हते आणि यायला पण बघत नव्हते, पण मी जेव्हा आपली गाडी यायची तेव्हा मी गाडीवर त्या रुग्णांना घेऊन जायची, कारण रुग्णांच्या मनात एक अपेक्षा असायची की आजार तर प्रत्येकाला वेगवेगळे आहेत आणि औषध तर एकच दिलं जातं. तेव्हा मी त्यांना समजावून सांगायची. म्हणजे अशिक्षित असतात त्यांना मी सांगायची, बाबा तुम्हाला औषध कसं दिलेलं आहे, डबी दाखवा मला. औषधाच्या त्या डबीचं झाकण येते कसं आहे, वेगवेगळं आहे ना, मग औषध पण वेगवेगळं आहे. तेव्हा त्या लोकांचा त्यांच्यावर विश्वास पटायचा. मी आरोग्य मित्राचं काम 2006 पासून करते.
हे काम करीत असताना होमिओपॅथिक औषधे देण्यासाठी
So I think this is one of the greatest problems that we have faced, that the medicines are the same and therefore they are not having faith. So we have to use a number of ploys and methods in order to indicate that what is the. So we started off with these 5 areas which are a problem for homeopathy and the aspects of introducing it in public health. And I think this project has proved that 4 of these areas, it is definitely possible for homeopathy to be introduced at a public health level. What now we have to prove is what type of scientific studies which will prove the efficacy. And one of the aspects would be definitely to take a control area and to try to see what are the incidences of the diarrhea, the teething problems in those different areas, and try to see what we are able to do. So that is the criteria D that we will now try to explore and do the impact assessment. And now we will, on the strength of this, it is possible for us to expand into further areas. We can establish clinics, homeopathy for the healthy child. We can have a special data recording proforma which will help us to collect data, and we will be able to link up with the Swasthya Balak Karyakram, and the government linkage will be much more firm and much more acceptable once this data is able to see. So we will have to do a training manual for the homeopathic practitioners, because that is where our homeopaths will have to come in and will have to play a large part. And I think this teamwork could not have been possible without the vision of the DG and the solid support which the headquarters was able to give in terms of the monitoring and the groundwork of the project officers and the research officers to see this through. Ultimately, the district health administration has to be acknowledged, and the ground health workforce, as well as the mothers and the families who have been exposed to this and who have accepted this. Thank you.
Good afternoon, respected chair, my co-speakers, dignitaries on and off the dais, student researchers, dear friends. I'm standing before you to deliver glimpses of what Kerala has done over the last few decades, especially in terms of public healthcare delivery using homeopathy exclusively. And I welcome the August here, and it's a privilege to be here on this CCRH platform when they are celebrating their 40 years of exploring science, as well as the 264th birth anniversary of our master. And bowing head before the master, I'll start my presentation. As you know, no ardent student, because we are all students in terms of homeopathic science, of homeopathic philosophy, they can survive without going deep into the master's writing. Every concept of homeopathy, whether it's new or old, can only be predicated with him. And he was the first person who saw the truth, and the others only nurtured it. Homeopathy in Kerala. Before coming to homeopathy in Kerala, you may be knowing that Kerala in fact has made tremendous lead in terms of public healthcare delivery, and Kerala model of healthcare has become globally accepted as well. We are, in terms of quality indicators with respect to health, we are matching with other nation standards as well. In terms of infant mortality rate, we have actually come down to single digit figure, that is, and we are targeting around 5 to be attained within the next couple of decades. And so definitely there was a health conscious, health supportive environment in Kerala, and definitely that has helped Ayush in general and homeopathy in particular. I'm just scribbling through the historical perspective that has happened, which helped the foundation of homeopathy in Kerala. 125 years ago, we got homeopathy into Kerala by the Christian missionaries, and it spread with the outbreak of cholera. Homeopathy was able to make a very good prevention as well as control, and thereby in 1920s and in 1928 we got a resolution, maybe the first resolution passed anywhere across the nation, to get homeopathy accredited as a recognized system. And the first democratic government, the first government itself started a homeopathic exclusive standalone dispensary in the year 1958. We were just celebrating the 60 years of that dispensary. And the history of recognition that started with 1943, after that there came the TC, Travancore Cochin Medical Act. Thereafter it was extended to the Malabar region as well, that is the northern Kerala. And this is the healthcare infrastructure or the organogram that we have in our state. We have two separate divisions, that is the clinical division and the education division. The clinical division is headed by the director of homeopathy, and Madam has, Dr. Jamuna is currently holding the directorship. She has 14 DMOs under her and an elaborate network of homeopathic healthcare institutions. And in the education sector, there is the director of homeopathic medical education. Currently, she is the senior principal, Dr. Jaya, and she is holding the post. And under this, there is a wide network of homeopathic standalone Ayush healthcare delivery system. That is what I wanted to focus. We have around 1,144 institutions catering homeopathy, and that is a standalone infrastructure. And I don't know whether you can find such a magnificent infrastructure anywhere in the world when compared to the density of population and the size of the state. Okay, and this is the spread of the institution. This is only a geographical representation, and we have around 700 dispensaries. We have district hospitals in each district. We have 10-bedded hospitals. And this is currently the health scenario, that is the infrastructure. This I have mentioned. But this figure I wanted to share with you. That is a huge number of patients attending the OPDs as well as IPDs. We have a very good base of patients. And that actually adds to the development of homeopathy, and that adds to the political will, as Dr. Isaac Golden sir was mentioning before. And the institutional framework, this is in fact a snapshot. We have homeopathic medical colleges 5, we have 1,244 institutions for other systems of Ayush other than homeopathy, but for homeopathy we have exclusively 1,146 institutions. And now about the innovations. See, most of these things will be done in elsewhere across the nation, but I'm just focusing on things that we have done over the past few decades. This is in fact the facelift program in Kerala that's going on now. That is the Janani program. It is the infertility care program, or really the homeopathic fertility care program, that is actually giving smiling face to millions of families. In fact, in Kannur, this project was launched in 2011, and the daily OPD was then started in the other 2 districts. Now it was a pilot project. Now it is scaled up to all the districts in Kerala. And in fact, in Kannur, we have more than 260 couples. They got their children, and we were able to bring smiles to their family. Thank you. And this team actually works in a coherent manner with an integrated approach. It includes medical officers and also consultant gynecologists, consultant zonologists, only to identify the diagnosis. Exclusively homeopathic medicine is only given. Other than that, there is no medication given. And this is the picture in which the politicians and the representatives of the population, they are with the happy couple who are blessed with homeopathy, and they got their children. And another flagship program that we have started is actually the Chedana program, which is actually the palliative care program, which is also widely acknowledged. And for the first time, maybe in the history of our country, that we have an exclusive standalone homeopathic cancer hospital. That is actually a 10-bedded hospital. It has fully fledged facilities of all intensive care as well, and we have got enough number of patients who are referred from regional cancer center as well as other cancer centers nearby, and definitely it is giving a very good service in the area. And this is just about the infrastructure that I have. Actually, I am lacking many of the photos because of lack of time. I couldn't show, but this is the center that is at Malappuram. This was also a pilot project. Now the same project has been scaled up to all the districts. And another flagship program is Sitalayam, that is actually a gender sensitive project that is primarily focusing on marginalized women in terms of their healthcare issues. And it is also an integrated service which provides not only homeopathic therapeutic medications, but also legal advice, counseling wherever needed, and also any rehabilitation wherever needed, especially in case of domestic violence victims. So it's actually a comprehensive program that's also piloted in some of the district and later scaled up. And this is another initiative that we started because many of the areas were actually inaccessible. We don't have health, even though we have very good healthcare infrastructure, but still we cannot afford to have some institutions in some pockets of the areas. In that unreachable areas, we provided some floating dispensaries. Actually, they are actually mobile medical units which routinely go to that pockets, that hamlets, and provide homeopathic medicine, awareness program, prevention program, everything is done. And this is another program, that is Sadgamaya, by which we will be delivering healthcare delivery to targeting the adolescent population. And we are also having a very good team network in this project, including a special education teacher. She can actually address the remedial education that has to be taken care of. And we have a psychologist, clinical psychologist, as well as an on-call psychiatrist who can actually diagnose conditions if there is a difficulty in terms of homeopathic diagnosis. And also they can make some counseling sessions, and they do the actually the psychometry as well as the IQ analysis, everything they do. So this is catering to the not only the learning disability but also the behavioral problems of the adolescents. Another program that is going far and wide is actually the Punarjani, the de-addiction program. You may be knowing that substance abuse is another very important public health issue that is happening now, and of course alcoholic dependence. So these two problems are actually addressed by this project. It is also a pilot project and it is about to be scaled up. It has not been scaled up to all the district, but it's another important area, just like Dr. Kumar Dawle was mentioning. We are also giving some training to the ASHA workers so that they can identify and refer these patients back to the institutions, which can form a network, and definitely that training can give them some idea. And also these projects are working collaboratively, just like when a lady comes in the Sitalayam project, she will be mentioning that there is a lot of domestic violence issues, and then we will be referring that to the Punarjani project also, because that spouse will be addicted of some alcohol abuse or substance abuse, that can also be taken care of. And this is another project, Ayushman Bhava. In fact, this project got its name before our Ayushman Bharat program itself, because we were conducting it for almost 5-6 years now. It is actually focusing on the non-communicable disease program, and just like Dr. Swasti Charan was mentioning, NPCDS program integration has not happened in Kerala, but we can have an integration just like with Ayushman Baba. And this project is actually a virtual integration, in the sense it is also integrating some good aspects of naturopathy as well as yoga along with homeopathy, so that the homeopathic doctor can take the case and give the medicine, and the yoga person can give some meditations and some yogic exercises, and the naturopathic person can prescribe some diet that can be peculiarly adapted to the patient with respect to the homeopathic medicine and with consultation with homeopathic physician. And this is another program, sorry the title is missing. It is actually tribal mobile medical unit, that is just like the floating dispensary that was in the backwater areas. This is in the interior areas where we don't have any access, but there will be a mobile medical unit going to that area, and these persons visit regularly on that. This is the snapshot of the area in which they will be. So there cannot be an ordinary vehicle traffic, so they go in jeeps and other vehicles available. This is just about the rapid action control program, that is the REACH, which is taking care of the communicable disease control in Kerala. And definitely the man behind this concept is here, Dr. Raviam Nair sir, my guru and my mentor. Can we have a good round of applause for him? Because most of these projects are his brain children, we can say, because many of these programs are actually nurtured by him. And in fact, after this coming of this REACH, we had plenty of researches being done, actually studies being done, which actually proved the efficacy of homeopathy in terms of homeopathic prophylaxis. And I'm just mentioning one of those studies because I was personally involved and I conducted that study, and we have discussed this with Chadraput Naik sir earlier also in many platforms. This was a study conducted very back in 2007. That was the first study actually conducted in Kerala in terms of epidemic, and multi-centric study that was conducted. And the I am not going into the statistical detail, but the p-value was very high, and the study was significant. P-value was very low, that means the study was very significant. And the prophylactic efficacy was about 82%. Now we are also conducting some specialty clinics in terms of separate diseases. Though we have the non-communicable disease program, we have separate specialty clinics for diabetes, asthma, allergy, anorectal diseases, hepatobiliary diseases. And we have some temporary dispensaries. These temporary dispensaries worked in a very big way to attract the publics, because wherever there is a religious gathering or religious function happening, especially seasonally, like you may be knowing in Shabarimala or in Maraman or in Hajj pilgrimage. So everywhere we will be setting up temporary dispensaries wherever we don't have permanent dispensaries, and this actually acts as a crowd puller. They can act as a actually base for homeopathic progress. So these are the innovations, and sticking on to the concept of innovation, evolve, progress, innovate, progress and evolve. So certain programs we were able to make it a progress. Just like example, the best example of progress that we can show is of course HomeCo, and that is the public sector undertaking, and Dr. Kumar Davle sir was mentioning about the kit purchase from HomeCo, being a GMB certified manufacturer. And they have a very good infrastructure. In fact, all the modern equipments they have, including automatic electronic potentizer, and the turnover details will give you some idea, because they are running over in profit for the last 20 years, and they are actually unable to meet the demands both in-house and in terms of export, and they are going to scale up their productivity in the coming years. And yeah, we have evolved in terms of some of the projects, because actually this school health program was our beginning in terms of our adolescent healthcare program. Now we have stopped this school health program, and we have shifted our focus to adolescent healthcare, so that persons who are screened from the schools, they will be referred to the centers, and then treatment will be given, rather than we going there and providing treatment at the schools. So this has worked a lot. And another program, just like our Janani program was actually an offshoot of national campaign on homeopathy for healthy mother and happy child, because we started this program way back when CCRH funded this program, and then we started separate mother and child clinics in every part of the state, and that actually started evolving, and then we got the concept that okay, homeopathy has something to do with for infertile couples, and that's actually the project of Janani. National Ayush Mission, you may be knowing, they are funding a lot of our projects, and only with their help that we are able to do some innovative projects. And they are funding very good, and last year we got some 23 crores with their approval, and state share was there, central share was there. These are the three projects coming under exclusively under NAM, that is the Shravya India project, the bronchial asthma research, the psoriasis management. I'm not going into the details. We are conducting regular training programs. We have been observing World Homeopathy Day. We have even conducted the NABH sensitization workshop, and it is a very encouraging news that NABH has come up with separate standards for homeopathy, and all our Ayurveda colleges as well as homeopathic medical colleges, they are going for NABH accreditation, government colleges, and that is a very good support given by the government as well. And I have my fellow assessors Dr. Chetana and Dr. Rejinder here, so they will be able to take part in activities coming soon. And these are the outreach activities that's happening everywhere. We conduct regular medical camps, and I'm just giving these slides because this will be made available to you. This consists of what all things Kerala was doing as pioneer work. First state to get recognized homeopathy, first state to start homeopathic dispensary in public sector, establishing 50-bedded homeopathy hospital, provide clinical facilities in government homeopathic hospitals for training students, to adopt a policy for homeopathy at par with other systems, first state in forming separate directorate for clinical services, and soon it will be having a separate director for medical education as well. Yeah. I'll be skipping this, and I'll be concluding with one or two slides. So this is more details you can have from the website homeopathy.kerala.gov.in as well as from Arogya Kerala. And I am stopping because as Robert Frost puts, we all have miles to go before we sleep. And finally, before conclusion, I will just inform you that there is a program that is happening in Kerala. I always have pleasure inviting you to this program, that is International Ayush Conclave, that is happening in Kerala in the next month, May 3rd week. And for more details, you can visit the site ayushconclave.org. Thank you, listeners, and thank you, Chair.
Thank you, sir, for updating different programs in Kerala. I now request Dr. Devdutt Nayak, scientist to CCRH, for his presentation on CCRH activities in epidemic.
Thank you, Rupali. Respected chair and dignitaries on the dash and off the dash, because this is going to be launch time, so we will be finishing this. I will be giving an account of studies undertaken for epidemic management by CCRH, and it comprises of recent few studies, few years. As we will be skipping this epidemiology part, but still I want to flag that India is the hot spot for all kinds of emerging infectious diseases. It may be zoonotic diseases, it may be wildlife, zoonotic diseases, drug resistance, any kind of, and all the epidemiology, if you go to the textbook of epidemiology textbooks, they always flag India one of the originator of many kind of resistant cases and new variety of diseases also. And to worsen this situation, as you are aware, we have a huge population and many regulatory deficiencies are there with respect to medication, all those things. And as we all are homeopathic doctors sitting, and few are there, other system, I want to tell that homeopathy got popularity because of epidemic diseases. It may be Hahnemann's that cholera, maybe it is Spanish flu, 1918, maybe it is all flu seasons, it has a name. To tell these things, because literature of a profession tells about its utilization. You can see this book, it is for epidemic diseases by Dorothy Shepard. You will not find many diseases which are prevalent now. You will not find dengue, you will not find chikungunya, you will not find West Nile virus, many things are not there. Rotavirus, many things are not there, because as we evolve, there are new diseases are coming, but we have not updated ourselves. Earlier, what council used to do, that whenever there is an outbreak, we call a group of experts and decide a genus epidemicus, and we distribute this medicine and declare this medicine as a genus and to have distributed among the population where it is affected. And you can see the number of times it was declared or distributed in different diseases during last 40 years. But since last 2 to 3 years, we have taken up to take next step, that many a time we have received a complaint from, maybe it is a policymaker, maybe from in parliament also there are questions that what is the science that you are telling that homeopathy should be used for controlling this type of diseases. There are many times these questions comes before us. So we have taken up that further step, that we should take up these drugs for to study and to generate evidence, so that we are in a position to give an answer scientifically. Rather, we will tell that historically we have used this medicine, Hahnemann has told this is the very effective medicine, but it should, data should tell that this medicine is effective, and this is the data and this is the statistics. Keeping this in view, we have though it was earlier, it was there, the epidemic cell was there in our council, but it was more strengthened in terms of manpower during 2015, and we have taken a few studies in between. And further, even if we have some drugs to tell that this medicine is effective, there a next level of question comes from our other profession, whether these drugs are safe. Though we know it is safe, but still we don't have safety data. And whether it has some evidence in terms of in laboratory based studies. So we have formulated a holistic approach, that the drug we will take for this type of study, we will have a preclinical data with respect to its safety, toxicity, preclinical effectiveness, then we will go for field study and also treatment study. And in that we have also incorporated to develop new drugs. And in that way, we are also trying to develop some of the nojodes and maybe some combination medicines we are trying to develop. And this is the first study we have taken during after this epidemic cell in 2015-16. During that, there was a huge outbreak of dengue in Delhi, and we have got permission with help of our Dr. Chadda. He was medical officer in Dr. Hedgawar Hospital. And we are able to give medicine to the dengue patients with thrombocytopenia, and you can see that 138 patients received homeopathic medicine along with standard care, and 145 patients didn't only received only allopathic care. And we have different categories of patients. You can see we have given treatment to from risk group, that is below 20,000 platelet count, to up to 1 lakh, that means they are under the thrombocytopenic cases. But in both groups, that is, after giving this medicine, you can see the day 1 where we have given medicine. The both group, it is very comparable, 26,000 in medicine group, and it is rather 1,000 less compared to standard treatment group. It was 27,000 in standard group. But after 1 day of giving treatment, that is the mean rise of platelet count, you can see the difference. It is around 10,000 more. And if you go to the third day of treatment, it is 20,000 more than the standard care. And coming to this data, if you will take a different view, how many patients got out of got rid of the risk, that means thrombocytopenia, because the benchmark is thrombocytopenia 1 lakh platelet count. How many patients reached to that benchmark, magic figure? The day 1, you can see nobody was there, with all are thrombocytopenic, but after 1 day of treatment, you see 10% in homeopathic group, they got out of that they got that magic figure of 1 lakh platelet count, but it is only 4.8% in standard treatment. And if you go to third day, with third day of treatment, we have around 60% of patients, they got rid of this thrombocytopenia. And if you compare to that, coming to that second part, there is question ki there may be a transfusion. But if you come to the, actually in India, the transfusion policy, even not in India, in other country also, there is no strict criteria to follow transfusion. Anybody who can arrange a platelet, fresh blood, may be transfused, even if he is having a 40,000 or 50,000 platelet count. But the standard is that if it is around below 20,000 with a symptom of that indication for bleeding or fatigue, any bleeding hemorrhagic phenomena. If we compare to that part, those who are having 20,000 below, there is a significant reduction in platelet transfusion in homeopathy group compared to placebo group. But if you go beyond that, where it was not needed, but there is no difference. And coming to this is the medicines given, you see the Crotalus horridus is the maximum prescribed medicine, it is not coming a percentage. It is around 80% patients received Crotalus horridus along with the standard care, and others are very minimum, few cases are there, but there are certain interesting cases here. If you will see here cadmium salt, there is one child around 8 to 9 years old, he was unable to sit up, just lying down, because that warning sign was there, abdomen pain, and it was a warning sign for dengue, and they have hemorrhage at that time, intestinal hemorrhage. So he was unable to, she was just crying, continuous crying. So we have given that day this cadmium sulf, and we used to give around 4 to 5 o'clock at that time, we used to give medicine, and next day morning we go for follow-up. And this was the one of the case, it was given us as a test, because when you have entered there, and there are a few good cases, we have got a good response. Then other side they told this type of response also we get. Then they told we will decide 4 cases and you will give medicine, and both side will follow these cases jointly. So it was one case, another case was 10,000 platelet count, another case was 4,000 platelet count. Out of that, in the next day, it was a good response we got. Around 3 patients, they become stable and they are shifted to the normal ward. So after that, they opened the door for this treatment, and we got maximum cooperation after that only. Another thing we have done that usually every season council gives health advisory for use of prophylaxis for dengue, chikungunya, etc. And in 2016, we wanted to know what we have given that advisory. Wanted to know at least in Delhi, in capital city, whether those who are coming to the homeopathy dispensary patients, whether they are using homeopathy prophylaxis or not using. And we did the survey with the 10 homeopathy dispensaries of our Delhi government. And the sad part is that 92% of patients are not using, and they are unaware about this type of advisory. And only 3% population, they use this medicine, and they use this medicine out of those coming. And overall, if you will see, it is 7.6% population consumed homeopathy medicine. This trial we have done in Delhi's slum area, that JJ colonies at Mayapuri during 2016. We have given Eupatria perfolatum 30 to around 12,000 population, and 3,000 population are under only surveillance. That means these are passive surveillance. We have given medicine. After the end of the season, we did a surveillance and survey of those population where we have given medicine, and another group of population, they are similar condition to residing with all the environment conditions similar to the medicine group. That is just all are belongs to the Mayapuri JJ colonies. The result we can see here. You will see the fever has decreased drastically. In control group, those who have not received the medicine, the fever was around 33%, and it is just 5% only in those who are receiving the medicine. And this is the week wise, every week what happened when you give medicine. First dose week means it corresponds to the doses also. Every week we give you one dose. So first week means it is first dose. You see everywhere the red color is that medicine group incidence. Every week the incidence figure is given. That means week 2, that is 66 cases of fever cases, whether the dengue, maybe other disease. And mostly it has gone down, remained below the maximum, below the level of placebo group. And coming to this protection rate, in terms of that, when you give a vaccine, they ask you in terms of statistics. Never there will be some percentage or something figure. You see the risk reduction means 91% population in medicine group are prevented with homeopathy medicine compared to placebo group. And if you come to the chikungunya, it is 97%, because that year there was a huge outbreak of chikungunya in comparison to dengue. And if you come to fever reduction also, even non-specific fever, all the etc., everything, it is around 84% risk reduction. Then we did another thing during that period, that data collection. We wanted to know whether those who are coming to the clinics and they have chikungunya-like symptom and they are treated in the dispensary, whether how they are doing with our medication, what is the outcome. We selected 10 dispensaries of Delhi government, and medicines they are given as per their choice and the potency they selected. You can come to know that maximum prescribed medicine is these 3 drugs, that is arsenic, bryonia, eupatrum, Rastrux and Gelsemium. Maximum was bryonia, and the different type of potencies used they are given. And the combination of symptom which was most prevalent among that patient group was temperature, fever with joint pain, headache and myalgia. That is around 49%. And this is the descriptive data, because this is only single group study, so we cannot tell how effective was medicine. There are no comparator, but still we can have that type of confidence that with first or second follow-up, maximum patient got rid of their symptoms. And this is already what Dr. Rajikumar told during 2007. We did also a cluster randomized trial in Kerala with bryonia. That was a very well planned study of placebo control trial. There the protection rate we find, because he has claimed a high rate of protection, that is around 90 or 80%, but with bryonia alba it is just 19.76, though it was significant. Statistical significance never tells how far this medicine is effective. It just tells ki your hypothesis is acceptable or not acceptable. And as you are aware that Gorakhpur is endemic to this JE or AES, and we have got permission from that BRD Medical College to have integrative management of that AES cases. And here you can see there is a drastic reduction in the death rate in homeopathy group in comparison to placebo group, where it is 43% and it is just 9%. Following that, there was a more extensive study that earlier it was just it was not a control trial, though it is a comparative observation study, means 2 groups are there, medicine group was there, that is number is more, but control group afterwards we have selected some 30 patients, those who are not received, and we compared. But this study was followed up by a more rigorous design, that is randomized placebo control trial, though it is open. But in that case, open study has also meaningful, because almost all patients are in comatose or semi-coma, that the placebo never makes a difference. And this is the distribution of patients among the groups. Now, that means homeopathy group, they have reached around 325 patients, and institutional management, that is only research medicine, are 323 cases. And the result is very encouraging. Means it should be implemented, though we don't know why such type of result after writing to the government also still it is pending to be implemented. You see, this is second part, death. It is 28% in control group, and because this figure is very magic figure, you know that 30% will die, 30% will survive with sequelae, and 30% will be of hair oil means they will be recovered. That still it maintains, it is 28%. But if you give medicine, it is coming down to the 13%. So even major sequelae also disability you see, it is only 2.8% in with homeopathic medicine, it is 9.9% with the placebo group. And the magic remedy here also still it is belladonna, it is continuing. If you will take belladonna, stramonium, arsenic and hyoscyamus, it almost it covers 70%. That means if a treatment modality can be given made with 4 drugs, it can cover around 80% patient can be protected. Means they can be given a better management. Coming to that, because we are doing in time series study, in 2016 we did that study, 17 also continued in that area along with some more area, JJ colony in this Delhi, and we have selected more area in like Jakhira, Piragadi, Chunabhatti, Kesab Bihar, Madhav Bihar like that, and we increased this population from 20,000 to 50,000 in medicine group and placebo 20,000 group. Here this is time we have knowingly kept a group of not placebo we are giving them a health education. That means we are giving how to manage their hygienic condition, how to clothing, hand washing, all these things, mosquito net, how to protect them from mosquito bite, all these things. You can see still the incidence of fever is not maximum difference is not there. Why? Last year there was no outbreak, the transmission of this virus was low. That never make difference. But if you come to dengue, it is a difference. That protection rate 61%. In 2016 it was 91%. Now it is 61% because when it is a high transmission, your effect will be magnified. When it is low transmission, automatically come down. But 61% itself is a big achievement because no vaccine gives, very rare vaccine gives a 61% of protection rate. Still it is a better option for when we don't have a vaccine in dengue, still it is a better option. Some other studies which I have done in between that results are not yet to come. One we have done with AES in Chargaon block, around 45,000 children are covered under this, and this is under follow-up. Study is over, it is now in compilation. Another we did in malaria, and you know Chininov solved yesterday, Dr. Papia and Dr. Upama Bage was presenting. That was it is a complementary study because we are planning a round study, preclinical, field study, safety toxicity, so that nobody should question, we should be sitting idle that we did this, there will be one question will come, again we will do that. At a time we are taking all the studies so that there will be one answer to all policymakers, all the other systems. So this we are doing in Odisha at it is a very remote tribal area, around 18,000 population are covered under this. And this we are just concluded now in these slum areas in Mayapuri, Piragati, where we are doing influenza 30. We have got a good result, but it is not that much because transmission was low this time in influenza in Delhi. We did a collaboration with the Homeopathy University in Jaipur, sir is there, their president Nayak sir. So we did this same study with a different objective, that we want to see if there is a, after receiving influenza, still somebody suffers from influenza, how their symptom severity will be. So this is a placebo control trial double blind, it is going on at Jaipur, because this year Jaipur was the worst affected city among, Rajasthan was worst affected among all the states. Of course now this season is over, and other than this we give health advisory, and there are some fact sheets also we have developed for our doctors. They can get this from our websites on chikungunya, on JE, AES, then from dengue and lymphatic filariasis, also influenza. Thank you. Thank you.
Thank you, sir, for your presentation. I now request Dr. Bhattacharya and Dr. Nalini Sharma for their expert comments.
I will request Dr. Nalini Sharma to tell about the speakers and their subject first.
Thank you, sir. I believe this session has been very informative, especially understanding what is happening at the international level and at the government level, including the center in the states, how they are dealing with different kind of diseases in the public health. So what Dr. Isaac Golden said was very right, that the position of Ayush, the position of homeopathy should not change in India once the political scenario changes. So it's a very important comment he has given it here. And we should not be disheartened with the NHMRC report that shows they're very biased with everything, because once they don't accept Pilate, which is internationally recognized, the massages, shishatsu, yoga, aromatherapy, now we are celebrating International Yoga Day throughout the world, and still they have doubts about the efficacy of it. So if they doubt about homeopathy, we should stop worrying about it. So I think we should really go ahead about what we are doing it, and we should believe into our principles of homeopathy. And Dr. Mr. Swasti Charan also said very good information about how Ayushman Bharat, we are going ahead and including NPCPDS program, integrating NPCDS program with homeopathy, with the Ayush, because if we can prevent the diseases at the primary level, we will reduce the burden at the tertiary hospital. So very, very good information, and a very good trial by the ministry about it. Then Dr. Dhavle have been always a big philanthropist, and working very nicely about mother and child program, and how they have training with Asha nurses, and the beautiful presentation, the video presentation they have given it, is really shows how the homeopathy is being taken at the rural areas. I remember having a meeting in Jaipur Institute, Research Institute, and they were talking about when they go into the interiors of the villages, they talk about what is the small homeopathic globules, you know, वो वही सेम गोलियां जो सब लोग खाते हैं, एक जैसी दवाई कैसे काम कर सकती है. So that myth is always there, and I'm glad that at the state level and at different levels, they're doing wonderful jobs. Even I have visited the Guwahati center, and there also we are getting very good results with the teething issues, because most of the deaths what we see, the children don't reach the 5 years of age because of diarrhea, because of upper respiratory tract infections, for various reasons. So it's a very, very good applause. It needs a big applause the way you're working, sir. And Kerala has given us a beautiful program, because I myself wasn't aware of so many good programs you're running there, like Janani, because fertility is a big issue. And infertility ke liye, I believe that it's a very expensive treatment. Forget the people are able to reach. They finally go to quacks to get them treated, because it is very difficult. If you go for an IVF, one IVF cost is almost 1.5 to 2 lakhs. And if homeopathy can do it, and especially if the project is going at the state level, it really requires a big applause to the state. And not only the floating dispensaries you are running it, the de-addiction centers, because Kerala is facing a major problem of alcohol abuse. And I was reading somewhere, I think if I'm not wrong, you have the maximum deaths because of alcohol. What I recollect, I may be wrong, maybe first, but the maximum deaths, the highest rates of widows are in Kerala because of the alcohol abuse. So if you are able to handle even the family disputes, the abuse that we see it at the marital level is also alcohol. So I think you're doing, again, the Kerala government is doing a great job, and especially now coming with the Kerala, the CCRH has come up with a research institute and PG program with the mental health. It's really, really appreciable. And Dr. Devadatta doesn't require our appreciation. He is always at a very, very high, I have a very high regards, because I think he's one of the most upcoming the scientist who's doing an excellent job in the research, CCRH. His wife, Dr. Rosa, also, I'm very fond of both of them. And they are very, very focused and dedicated. And I'm aware of how he has been working with dengue and chikungunya preventive. But the most alarming fact that he has given is that in spite of we, private physicians or the government putting the ads, still only 3% of people, population is taking preventives. And 97% of population coming to the hospitals are not aware that homeopathy is giving some preventive medications. So as a whole, we should work on it and we should spread this word and go ahead about it, because prevention is definitely better than cure. And now the studies are showing us we should, go with thumping thing that yes, homeopathy can prevent dengue and chikungunya, because in coming months we will be again facing this epidemic in all the states. In fact, last year Maharashtra had a very bad cases of outbreak of chikungunya and dengue. So again, July, August is a season, so we should go ahead about it. Thank you so much.
Thank you, ma'am. Thank you for your votes. I now request Dr. Bhattacharya to felicitate Dr. Golden Isaac. To Dr. Dhawale. Dr. Dhawale. To Dr. Reji Kumar. I now request to Dr. Nanni Sharma to felicitate Dr. Swasti Charan. To Dr. Devdutt Nayak. On behalf of CCRH, I am thankful to all the speakers for sparing their valuable time, and especially I request Dr. Chaturbhuj Nayak to felicitate Dr. Bhattacharya. Dr. J.D. Daryani, sir, please.
Please, out. Please, out. It will be a good.
Sir.
It will be a good photograph for us. Please,
X and H. Okay, it's a privilege. Okay, congrats. Congrats.
I request Dr. Nayak to felicitate Dr. Nanni Sharma. I request Dr. Chaturbhuj Nayak to felicitate Dr. Nanni Sharma. Please, for a group photograph.